We are concerned after looking at the 42 different robotic credentialing policies that we reviewed. We saw a wide variability in the different policies, and while some of them were very detailed and provided very clear expectations from the credentialing and re-credentialing process standpoint, there were many policies that did not provide specific definitions, and I think that there's a lot of room for concern regarding the verification of proficiency of the robotic surgeons credentialed by the majority of these policies. After reviewing our policies, I think the most concerning and frankly egregious aspects of these policies were the lack of outcomes monitoring that we saw. Often the surgeon would be credentialed and the policy would not follow up with regards to either maintenance of privileges volume, so the number of cases a surgeon needs to perform in a year in order to maintain their credentialing policies. And often there was a very long or ill-defined gap limit, so how long the surgeon can go in between robotic cases in order to maintain their privileges. So based on the results of our study, what we'd recommend moving forward, and a project that's actually underway, is a consensus gathering study called a Delphi study, in which a bunch of robotic surgery experts are getting together and creating more detailed guidelines for robotic credentialing so that individual institutions will have now a reference when they go to create these policies.